As I go through life, it's an endless stream of special moments and hopes and dreams. I hear a song and it calls to me about the ones I love, friends and family. It's always good to know I'm on my way home. I got you on my mind wherever I roam. So many ups and downs, but there's one thing I know. I'll be with you soon, I'm on my way home. I'll be with you soon, I'm on my way home.
Welcome to this Axxess LinkedIn Live conversation. We're so glad you're here. We're using conversations like these to bring you a wide variety of conversations on an array of topics. We're hoping that you learn something from the experts that you meet along the way. We encourage you to join in the conversation in the comments and ask any questions that you have about today's topic. My name is Laura Barnett, and I'm on the marketing team at Axxess. It is our goal for the future of healthcare to be in the home. And while the pandemic hit hospice organizations hard, it also illuminated the value of care in the home. Because of this, Axxess partnered with Aging Media to conduct a survey on the temperature of the hospice industry and understand the pertinent issues. Some results were expected, others came as a pretty interesting surprise, and that's why we're talking with Jim Parker today to dig into those results. Jim has worked for the past several years as an editor for Hospice News, published by Aging Media Network. Before this, he was the executive editor and wrote for the Joint Commission Resources, helping healthcare organizations across all settings improve patient safety and quality. Welcome, Jim. Let's get started. So our first question, we already mentioned that Axxess and Aging Media partnered to host this survey for the hospice industry. Why do you think this survey was important at this time?
Well, as you noted, the pandemic drove a great deal of change and placed a tremendous amount of strain on healthcare providers throughout the continuum. And of course, hospices were no exception to that. I think it's essential to gather data on what they've experienced, how they've needed to adapt during the pandemic, and how that's going to affect their business and clinical operations in the long term.
That actually leads really well to my next question. 84% of respondents said that they started using telehealth in response to the pandemic. We didn't really see that as a big surprise, but what did come as a surprise was the after effects of telehealth. Can you tell us about some of the downsides of conducting those remote visits that we really didn't anticipate?
Yeah, I think generally it was an imperative for hospices to use these methods during the pandemic. And I think generally it served them well, and that most providers have a positive perception of telehealth. But of course, virtually every action has its benefits and its drawbacks. I think in this case, some of the bonds that tend to form between the hospice clinical team and the patient and family were more difficult to establish and maintain through a screen. And also for many organizations, there were some unanticipated costs to purchase devices or software or other infrastructure to put these systems in place. And staff also needed training for how to use these systems, how to provide care virtually, which of course is a different, somewhat different animal than providing care in person. And these were all tasks that providers needed to implement very quickly. So they were kind of learning on the go and adapting on the go. And that presented some challenges.
For sure. Some of these findings might perhaps convince organizations to forego using telehealth. Have you heard of any particular strategies that organizations who've had success transitioning into a telehealth kind of model, anything in particular that they've done that has helped them with that learning curve?
Of course, I think there's a few considerations here. Providers at this point with widespread vaccination, they're already beginning to ramp up their in-person interdisciplinary home visits with patients and families, but they are using telehealth to augment those services. rather than replace them, which I think is a key point. They can use telehealth to kind of triage patient needs, determine whether a home visit is necessary, and it helps them build efficiency in terms of employees' travel to the patient's location. And it also helps them ensure that they are responding to the patients who have the greatest immediate need. It's also really good just to have that touch point available to patients and families. When a patient or a family member wakes up in the middle of the night and they're anxious or they get scared or unsure of how they're feeling, many tend to call an ambulance or go to the emergency department. Telehealth can allow providers to intervene, to allow the hospice provider to intervene more quickly, to determine how they can meet the patient's needs without the need for higher acuity care.
Another concern for hospice organizations who turn to technology is a lack of reimbursement. Are there any rumblings that you're hearing about a change in regulation to support that technology?
There are rumblings in terms of providers and the various industry organizations and associations are pushing for some type of reimbursement structure for telehealth. So far, there's no indication that one is in development. CMS put out its proposed rule. No, that's not the final rule. For 2022 that kind of governs payments and updates conditions of participation for the coming fiscal year for hospice. And that proposed rule did not contain any billing codes for telehealth. So the concern is that, they're providing these services, they're providing this care, it's not really being documented or captured anywhere. It's not really counting towards their quality metrics. It's not being captured on their cost reports that they submit to CMS, which helps, among a number of other pieces of data, it helps determine what their, per diem reimbursement rates are for the coming year. So I'd be curious to see how this impacts payment in the long term, because if hospices are showing, lower costs on those reports due to telehealth, could that affect, lead to a reduced per diem?
Gotcha. I think the use of telehealth we didn't really see as any sort of surprise, but what was unexpected was regarding the interdisciplinary group, and we know how crucial that is to hospice care overall. A third of the respondents reported there was a lack of ability for IDG to function the way it was designed. That's a pretty significant setback in hospice care. Why do you think they experienced this?
I think a key point here is the difficulty that hospice providers had accessing patients in facilities and skilled nursing facilities and assisted living, senior housing. A lot of these, of course, we all know these facilities were locked down during COVID. Many of them were hit very hard by the pandemic, saw lots of infections, unfortunately, many deaths. And, they restricted access, as to who could enter their facility, and that included hospice workers to a large degree. So very often a nurse or maybe a licensed independent practitioner, like a nurse practitioner, could enter to visit with the patient. But in a lot of cases, the other members of the team could not enter the building, whether it was social workers, chaplains, aides, the other members of the interdisciplinary team. Volunteers are another important consideration. Many of them were unable to access patients except through a telehealth. So I think that's really the root of this issue, was that difficulty accessing patients in facilities and maybe just patient anxiety about how many people they bring into their homes during a pandemic, and the potential exposures that could happen there.
Yeah, where else have those caregivers been and who have they been seeing? The results from the next question that I want to cover are really shocking. Jim and I were startled by this. 72% of respondents answered that the emergence of value-based payment models for hospice either did not or will not influence their decision to provide palliative care. What's your first thought on why that number is so high?
This did throw me for a loop, because really a palliative care program or other service upstream of hospice is really essential to succeeding in value-based care programs. The value-based insurance design model, or Medicare Advantage Hospice Carve-in, requires participating providers to have a palliative care program. So this did surprise me. My thought, based on anecdotally the many conversations I've had with providers over the year when we talk about palliative care, is that I think there's a genuine sensibility among these providers that people need palliative care, and providing it is the right thing to do. And that really is a key motivator for them. I know when I interview some providers, if they're launching a new initiative, launching a new service, I'll ask them, as a business journalist, I'll ask them, what will, your return on investment look like for this? And a lot of times I'm greeted with kind of a long pause, and, they answer, well, it's the right thing to do. It'll help our patients. I don't think we're going to make any money off of this, but we, feel that it's important. So I think, if we exclude value-based care, as our results kind of indicate, I think that's a prime motivator.
Now, it certainly isn't affecting hospice organizations wanting to add a palliative care program. A majority of respondents confirmed that the pandemic increased the demand for palliative care. What legislative groundwork is currently being laid to support adding a palliative program?
There isn't a ton right now from a legislative perspective. There is a lot of lobbying going on for a demonstration of a potential community-based palliative care benefit within Medicare, similar to the hospice benefit, where it's that dedicated payment to providers for palliative care. There have been some in the industry who have been talking with CMS, who said that, this could very likely happen in the near future, maybe even this year, that such a model or demonstration would be announced. I believe Congress would have to intervene to make any of these programs permanent, but the Center for Medicaid and Medicare Innovation has the authority to create these demonstration projects, these tests, to design the model and see how they work. And I think that we'll probably see something more along the lines of a demonstration project implemented by the executive branch before any legislative action.
Interesting. Well, we will look forward to that and certainly tune into your coverage. I'm sure you'll be all over that. Axxess has a series of blogs that really delve into everything you're going to need to know to start a palliative care program, from certifications to reimbursements to eligibility. We're going to post a link to those in this chat so you can see that below. What can these professionals learn from your survey findings to help them succeed in palliative and hospice going forward?
I think it's key. One key point is just the rising demand. More people know about these services, more people need these services. Those numbers are only going to grow. And, there's an opportunity there to both build up, their business and their patient census, and to really care for people in need. We discussed how surprising those results were related to value-based care as a motivator for launching palliative care. Nevertheless, I think they can glean, the importance that palliative care programs can play in their, in regards to their participation in value-based programs. I think it's important for them to be able to kind of benchmark and see where they stand in relation to their peers and other organizations as far as the developments related to telehealth are concerned, how it's grown, how it's being used, how they anticipate using it going forward.
Well, Jim, thank you so much. This has been a really helpful conversation. I appreciate you taking the time to visit with us today. You can read more of Jim's coverage of the hospice industry on Hospice News at hospicenews.com. Understandable, very simple. Thank you all so much for joining us today for this LinkedIn Live conversation. Make sure to check the chat for links to the survey as well as those palliative care blogs that I mentioned. Have a great day. Thanks, Jim.
Thank you very much.
It's always good to know I'm on my way home. I got you on my mind wherever I roam. So many ups and downs, but there's one thing I know. I'll be with you soon, I'm on my way home. I'll be with you soon, I'm on my way home.